Good morning. My name is Stephanie Burrows and this is my presentation on health promotion, showcasing how organisations and models aid in promoting public health. What is health promotion? Health promotion is the process of enabling an individual to improve their health and therefore their quality of life, but it also aids in helping a person to have more control of their lives. The main focus of health promotion is using different models to encourage good habits through social and environmental interventions with health professionals and organisations. There are many different model approaches which will be discussed in the upcoming slides. The different models which aid health promotion. There are many different models which aid medical professionals in ensuring the best possible outcome for their patients. In regards, these include social model, socio-ecological model, the health belief model, the social cognitive theory, and the stages of change models. We will look into these models in more detail in the upcoming slides, starting with social model. Social model. Health is not determined by just simply physiological changes, but by a broad range of factors, including social relationships, economic stability, cultural and political factors, and access to healthcare. Using a social model of health ensures that health professionals consider these key factors when they have an impact on a person or communities, and so involve these communities in planning solutions to health inequalities. The socio-ecological model. The social-ecological model builds on the social model and places emphasis on the impact of an individual's environment and the desire to understand the relationship between personal and environmental factors. Yuri Bronfenner developed the theory where he looked at the interplay between 5 environmental factors to aid the medical professionals to focus on specific behaviours with multiple factors. These factors include public policy, national and territorial local laws and policies. Community, designing access and spaces. Organisational, organisations, schools and workplaces. Interpersonal, family, friends and social networks. Individual, knowledge, skills and attitudes. Moving on to the health belief model. Social psychologists developed this theory in the 1950s with the aim to be able to explain and predict the health behaviours of individuals. A person's severity of potential disease and susceptibility can be impacted by modifying behaviours such as demographically and socio-ecologically. Examples of these include: if a person feels threatened by a particular condition, they may change their attitude towards their health and take action to prevent the condition. If, however, a person feels they are no longer at risk or at lower risk, they are unlikely to take action in changing their healthcare, as they may believe changing is less beneficial to keeping things the same. The social cognitive theory. Social cognitive theory focuses on the observational learning of individuals. There is a deterministic relationship between the individual, environment and behaviours. Modelling is an integral part of social cognitive theory, as it states that when an individual witnesses a behaviour and consequence, they will memorise it and use it to guide future behaviours. It refers to the belief that a person can perform and carry out behaviour within their ability. And finally, the stages of change model. The 6-stage change is often used to support alcoholics to overcome their addiction. If an individual can comprehend their readiness to change, then it can be used to support them to develop the right course of action. The 6 stages include Pre-contemplation, the first thoughts of changing their behaviours. Contemplation, serious thoughts of change. Preparation and determination, preparation to take action to change their behaviour. Taking action. Maintaining the action taken, and either relapsing and having to start again, or termination of the addiction and behaviour completely changed. Comparing two models in health promotion, the health belief model and stages of change model. Making a comparison between the health belief model and the stages of change model, there are few similarities between the two, such as both models emphasising the importance of behaviour change in promoting health and preventing disease. They both acknowledge that the role of the social and physical environments which help them to shape behaviours. And they highlight the need for intervention that tailors to personal needs and readiness to change. Differences. There are differences between the two models too, however. Both models are based on different theoretical frameworks and concepts, which leads to variations in how they approach health promotion. The two models also prioritise different constructs, such as susceptibility in health belief and self-efficacy in the stages of change model. Some models focus more on individual factors and others will consider broader social and environmental determinants. The strengths and limitations of the health belief model and the stages of change model. Although the health belief model is beneficial in predicting and helps to explain health behaviours in patients, it also has some limitations as well. The health belief model, it focuses on patients' perception of their susceptibility to a health issue, but it may not address other health behaviour influences like cultural and environmental influences. Also, because of the limited focus on perception rather than other influences, it neglects other complex behaviours such as obesity and smoking, which are influenced by social and environmental factors. Moving on to the stages of change model. The stages of change model is used to support addict patients to support them to overcome their addiction through 6 stages. However, there are limitations with this model, such as relapse being a common part of the model, and the model acknowledges relapse, but people may consider it to be a failure. And older adults may be less susceptible to the stages of change, as they may find changing to be less beneficial to them, as they have been a certain behaviour for a longer period of time. Effectiveness of models in promoting health. When a model is implemented correctly, it can promote positive health behaviours and can be effective in improving the public's well-being. There are a few of the key factors to consider when choosing the correct model for each individual. Evidence-based. Models have been tested and validated through research and are more likely to be effective in promoting health behaviours. Tailored approaches are good for targeting the population for their specific needs and characteristics, promoting better outcomes. Techniques in behaviour changes, including goal setting, self-monitoring and incentives. Sustainability. It's important to maintain rather than finding short-term fixes. Long-term behaviour changes are more likely to lead to lasting improvements. And finally, evaluation. Determines the effectiveness of health promotion models and allows for continuous improvements based on feedback and data. We're going to now move on to the Change for Life initiative. When promoting health, initiatives were introduced to help the public health. Change for Life was launched in 2009 in England, which was a social marketing programme aimed at combating obesity and the implemented health issues attached to it. Change for Life was aimed at families as an interactive way of making healthier choices together. The 4 stages of Change for Life campaign. The purpose of the Change for Life campaign is split into 4 stages. Alert, educating families on the dangers of excessive sugar consumption. Motivate, educate families on the different dangers of excessive bad eating and personalise it to specific families. Support, encourage them to download the Sugar Smart app and providing free assistance. And finally, sustain, encourage parents to buy fewer high sugar contents, ensuring children eat less sugar in their diet. The aims and objectives of Change for Life. The main aim and objectives of Change for Life includes 5 a day. Suggestions were offered to families for ways to eat 5 portions of fruit and vegetables a day. 400, 600, 600. Advice on watching calorie intake throughout the day, with 400 calories for breakfast and 600 for lunch and 600 for dinner. Watch the salt, raising the awareness of too much salt intake and encouraging reduction of amount eaten each day. Cut back fat, information about good and bad fats and how to reduce the bad ones in a family's diet. Sugar swaps, raising awareness on how much sugar is found in foods and good food alternatives to reduce sugar intake. 100-calorie snacks. Snacks are welcome in a family's diet, but it is encouraged to keep them to 100 calories or less. And finally, get moving every day, emphasising the importance of leading an active life and offering suggestions on how to get families moving. The effectiveness of Change for Life. The Change for Life brand grew quickly and responses to it were and are overwhelmingly positive, with 400,000 families joining the campaign within the first year and over 1 million other families claiming the campaign had a direct impact on their family's behaviour towards a healthy lifestyle. The limitations of Change for Life initiative. Change for Life is a fantastic initiative which gives individuals and families eating healthier and getting active, but there are also limitations, such as it promotes calorie deficit dieting and focuses on calorie counting, which can be harmful to people who have an unhealthy relationship with food and are vulnerable to eating disorders and obsessive traits. Although the initiative is congratulated on its personalisation for individuals and families, it is not taking the broader picture into consideration, such as affordability and accessibility for certain areas and populations. Concerns on ethical levels. There are also ethical issues, as some of their more emotional appeals were triggering to some who suffer with food anxiety and guilt, and was seen to be fat shaming. Moving on to organisations. The National Institute for Health and Care Excellence. I'm going to talk more about the National Institute of Health and Care Excellence, which develops guidelines and recommendations for healthcare professionals and the public on their most effective ways to prevent, diagnose and treat health conditions. These guidelines mainly aim to help ensure a consistent this organisation conducts research, identify health trends. I've read this wrong, sorry. These guidelines mainly aim to help secure consistent, evidence-based healthcare across the UK. This organisation conducts research to identify health trends, assesses the effectiveness of interventions, and provides evidence-based recommendations to contribute towards improving the health, as well as providing valuable information and resources to educate the public on health risks, preventative measures, and a healthy lifestyle. However, the limitations of the National Institute for Health and Care Excellence. The National Institute of Health and Care Excellence enables medical professionals to have evidence-based knowledge to help advise and educate the public on health risks. However, there are limitations, such as the significant need for resources without the appropriate funding. As with a lot of health companies and organisations, funding can be lacking with the need of resources, such as staff training and new technologies, for treatments. If the funding is not available, it can cause the research to be less quality and may not address specific patients' needs due to a broad population research. Although the evidence-based research is beneficial to aid in the patient's treatment and advice from medical professionals, the research may not cover the overall picture, as it is looking at a broader population rather than the specific patient's needs. Thank you for listening to my presentation on promotional health, with discussions on different health models to improve their public's health, along with the Change for Life initiative and the National Institute of Health and Care Excellence organisation. On my next slide is my reference list. Thank you again. Thank you.